Yes, sir. Started.
Okay. Thank you. Thank you, IT. Namaskar. I am Dr. Alok Roy. I bring you this webinar, which is titled Health is the Ultimate Wealth. We have learned in last 2 years that unless you are healthy, you cannot do anything in life. You can't be even educated, can't earn money, can't do anything in life unless you are healthy. And every week, every Saturday, 5:30 to 6:30 in the evening, before you get busy with your soap operas and other evening mundane things on weekends, we bring you this webinar. Now, every week we select a topic. And normally what we do that we ask around that which are the topic which interest people. This time I met someone on Monday who said that I am suffering from piles. So, and it bleeds off and on. So I thought such a common problem. Many of our patients have these piles. We call it piles, hemorrhoids. Doctors have various names. Then we thought that why not talk about it? And what the best method? It was a time when the treatment was a little difficult, but with the advent of laser, it has become much easier, much more cost effective, and patient goes home, not much of suffering. So I spoke to Dr. Chand. Dr. Chand is our senior consultant. He does almost 100 surgeries a month, along with his colleague, Dr. Naik. Dr. Chand and Dr. Naik are from Orissa, but Kolkata is their home. And they are one of the finest surgeons Medica has. And we are very proud of this duo. So we thought that let him talk to you, let him tell you what are the commonest problem of piles, fistula, hemorrhoids, what they call it in medical language or other languages. So with this, I hand you over to Dr. Chand. Dr. Chand, please elaborate. And my request to you would be to make it as simple. And don't show pictures which my viewers may not like. So give us the reason why piles happen and how to treat it, and let them know that it is nothing to worry about. It's something which can be handled very easily. Over to you, Dr. Chand.
Thank you, sir. It's an honor and pleasure to be in Medica, and you have given me such a big platform, and it's a great honor to sit with the same platform and talk to our esteemed patients. And I'm very happy that you have selected a very common topic which bothers our common public, because these diseases are prehistoric diseases. Since the inception of mankind, these diseases are prevalent. The entry point and exit point takes all the assault, sir. So we have piles, that is hemorrhoids, we have fistula, and we have fissure. These three diseases in our perianal region, it bothers a lot, sir. And mainly the hemorrhoids.
What is perianal region?
Perianal regions means the anal verge where we pass our stool, and the area inside and surrounding area, the around 2 centimeter around our anal verge is called the perianal region and the anal canal. So these diseases are prevalent in this place, sir.
So that's a very short segment of 2 centimeters where our stool passes. In and around that area of 2 centimeters, you call it perianal region. And most of the problems happen in those 2 centimeters.
Sir.
Okay. Go ahead, Dr. Chand.
So, like people cannot understand, these three diseases have got a very classical finding. You can diagnose at home also. Like first I will come to hemorrhoids, that is called piles, layman language. Piles means the patient comes to the OPD. He will share ki I have a bleeding. He will have a painless bleeding. He will have a feeling of grape-like structures around the perianal region. When he passes stools, they pop out, and sometimes he pushes it, they go in, and he will have a painless bleeding, and he will have a history of constipation. So this is called hemorrhoids or piles. Now next disease I would like to come, that is called fissure in ano. That is one of the most painful disease of the perianal region. Patient comes to the OPD, he will have a classical saying, he will have a burning sensation and painful defecation. He will have a spasm as if he is suffering from an abscess in that area. It's a very, very painful, and he cannot pass the stool properly, and it's very discomforting. And the third disease is called fistula. Fistula is, if I say our anal canal, through which we pass the stool, if we take it as a national highway, like all your stool passes through that, another service road comes out. Suppose it is an anal opening, and you will have another opening beside your anal opening, a small opening from where you will have a chronic discharge. So this is the main road. Another service road comes out from this, through this, all the juices, the stool juices, they come out, they make an abscess, then it's very painful, suddenly it bursts and the pain goes away and you feel nice. Again, it starts passing the discharge. So you'll have a continuous discharge. Perianal discharge is very disturbing. Your clothes get wet like that. So that is called fistula. So we have got 3 diseases, sir. And for hemorrhoids, I usually diagnose them by examining in my OPD. Then if he has a severe bleeding and all, to exclude if any other source of bleeding is there in the entire large bowel, whether any polyp is sitting above or any tumor, before I operate to exclude it, I definitely go for colonoscopy, sir. And for fistula, definitely for fistula, I do an MRI, because MRI gives me the roadmap for my surgery, which surgery I should do. Then I discuss with my patients that whether it is very high up, whether it is a complex fistula, whether it has got many inroads inside. So according to that, I select which procedure is the best for them. And of late, and for fissure, it is a pure clinical finding and patient's history, that is for fissure. And the beauty right now is we have many modalities of treatment since the inception of mankind. This seton, cutting, then this, then finally, I'm very thankful to our scientist who has developed this diode laser. With laser, we are able to deal with all these diseases. They are painless, they are scarless, they are bloodless, and the hospital stay is very less. Your man-hour loss is very in my hospital, in Medica, we have got the ultra-modern laser, sir has got for us. And most of the patient we admit in the morning, and it is a daycare procedure, and maximum is 1 night stay. Like I select the patient, whether they are having any comorbidities, whether they need any support from other departments, then either they are diabetic or anything, then only I keep for 1 day. Maximum is 1 night stay, and patient comes home, comes happily, goes away happily. And it's a very nice surgery, it's a very precise surgery. And the post-operative, particularly in this type of diseases, what happens, that part is assaulted, that part is operated, and every day you have to pass the stool through that. So the most important thing is that area should be kept clean, and proper ointments, medications has got very little role. So after operation, in a traditional operation, what happens? You have to take a lot of cis bath, ointments, post-operative care is a bit lengthy. But in case of laser, since the assault, since there is no cut, since it is a very precise pointed surgery, the post-operative hassles are very less. Like you can go to office in 2-3 days time. And one beautiful thing I have discovered, for every patient I operate this piles, fissure or fistula, in my OPD, I make a promise from them, before you get operated, you bring along with you called a piles pillow. That is a tire-like thing, which is available in Flipkart, in Amazon. It's only 800 rupees. They get it in a bag, they get operated, you can put it and you can sit on it. The very next day, you can drive your car. So that is the beauty of this thing. And I have got so many good feedbacks, because this thing has come up new. For last 4 years I have been doing, and patients have gotten extremely good feedback, and we are getting patients from Bangladesh, throughout the Eastern India, complicated cases, variety cases, and results are very good. I am very happy with those results, and every day even I am getting wiser. I am also choosing, I am also telling my patient which procedure I should do, which one is better for you, best for you. So laser is a very fantastic modality of treatment for proctology, and what I will say, it's absolutely mind-blowing machine and mind-blowing result.
Okay, you can start.
Sir, I'll share my PPT, a short one. Laser proctology, myself and Dr. Gaurang Naik, he is my friend, he is my brother. We both are laser proctologists. Next. And this is my hospital, Medica Superspecialty. This is the laser machine. It's just 2.5 kilo. It's a very small machine, but it has got a very smart brain, and it has got a small pen through which it's a very precise thing through which I operate inside and inside the rectal anal canal, and I have got other machineries through which I approach my target. It is like Balakot surgical strike. I go fast, I go in quickly, and precisely I come out. Next. So this is this has got this wavelength. This is about machines, and with this laser machine, what happens? The difference between a normal traditional surgery and laser surgery. In laser surgery, what happens? The area of operation is very precise. The blood loss is very less. The nerve endings cut are very less, and bleeding is very less. It is a scarless surgery. So that is what the laser brings. Laser is known as light amplification by stimulated emission of radiation. So light energy is converted to heat energy, and through that I go. We have got various wavelengths. I've got various joules and everything through which, these are all scientific things, through which I operate very precisely. Next. Next. And excuse me. And in laser surgery, the anesthesia, I don't need general anesthesia, mainly local, regional anesthesia we do. So anesthesia time is very less. The operative time is very less. Like doing a fissure, it hardly takes me, you can say 60 seconds like that, or even less. Means I mean particularly that laser strike, that takes less than 60 seconds. Yeah, preparing the patient pre-surgery and the post-surgery is the time. But time is very less, and very precisely it has been done. Next, please. Next. Yeah, like just a comparative study very quickly. You can see the anesthesia is local. This is the general. It's a daycare. Like you come in the morning and you go back to the home in the evening. But here you have to stay for maybe for 3 days to 7 days. You have to stay. Pain is very less, but pain is very high in other procedures. Recovery time here is 3 days. There it is almost 10 days to 2 weeks. And recurrence, yes, the very important thing right now I like to highlight. Whenever a patient comes to my OPD, they are very concerned कि sir eta abar fire asbe na to in Bengal they tell je ye wapas to nahi aayega. I tell them कि yes, these diseases has got the propensity to come back, but with a laser, in my last 4 to 5 years of experience, definitely the recurrence rate is definitely very less in comparison to other surgical procedures which we have. And yes, another thing is complications. Yes, since the area of operation is very less, very precise, so tissue damage, surrounding damage is less. So complication is also very less than the traditional surgeries which we had been doing prior to laser. Next slide, please. Yeah, I'll just highlight what are the advantages. Just a point, it has got a high success rate, it has got low recurrence rate, quick treatment, minimal invasion, minimal blood loss, minimal pain, and it is less traumatic also. Agar zyada main katunga nahi, to darad bhi bahut kam hoga. This is what I tell my patient, and it's an instant relief. The pain which you had prior to the surgery in fissure, the very next day laser surgery or in the evening, they just bless me. Doctor sahab, aapne magic kar diya. I think मैंने magic कुछ नहीं किया. I just did the thing for which you are having a pain, it has been solved, and recovery time is very fast, and it has got a very precise surgical precision, and definitely infection is much less than traditional surgery. Next slide, please. Yeah, this is hemorrhoids, piles. Which in a layman language it is called piles. It has got grade 1, grade 2, grade 3, grade 4. जैसे बच्चा छोटे से बड़े होते हैं, this thing also grows from small to bigger. Okay, these grades are very important for me because with this grade I select what type of surgery I should do. Grade 1, grade 2, grade 3 we do laser. Grade 4 also we are doing laser, but yes, sometimes it needs 2 sitting. But a prolapsed grade 4 I do stapler, which is also an ultra modern thing. I use a stapler gun so that circumferentially I do it. That is also a very fantastic procedure, and also the patient goes back home in one night stay. Next, please. Yeah, this is fistula. This disease is the most treacherous disease out of all those 3, because this has got the highest recurrence rate from all those diseases which I discussed over here. So see, in this you can find out, this is, if this is the main national highway, and you can see those red lines. These are all service road coming through the main national highway to the external points. And you see how they are entering, I mean, how they are coming from different level. So by MRI, that is, I do an MRI that is like a CT scan of that place. With that, I get a road map which type of surgery I should select. Like most 80% I do by laser, but yes, 100% I don't do by laser or for fistula, because if it is above the levator and it is very high up, then the valves and all may get damaged. Then I do a traditional set-on surgery. So this is a treacherous, but yes, with laser we are doing very nice, and patients are highly benefited. And yes, in my last 4-year study, I have seen the recurrence rate, which is written in our book, which is around 15%. With laser, definitely it is less than 5%. Next, please. Yeah, this is another disease called pilonidal sinus. Pilonidal sinus is it is called Jeep bottoms disease. Like in your gluteal cleft, because a hairy person, if they have, then in the gluteal region, those hair pierces and it forms a sinus-like thing and continues. There is a discharge. Usually it happens in drivers and people who are having a lot of hair, school teachers, like that. So laser has got a fantastic role in this, and I really love doing it laser, because in traditional thing we have to cut a very big part. Recurrence rate is very high, and since the person has to sit over it, and since the person walks, these 2 gluteal muscles, they graze each other, so he has a lot of discomfort. But with laser we just make 2 holes, and by that the entire surgery is done. We ablate the entire tract and the patient goes back home. In last month or something, we had done around 5 to 6 pilonidal sinus. All are doing very well. Even today I saw in my follow-up patient in the OPD, they are excellent. They are doing excellent. Next slide, please. Yeah, this is called fissure. Fissure means this is a very painful disease, but this is a very magnificent disease, because this disease does not come back. It has got no recurrence. If it recurs, then I think some problem was with the surgeon skill or surgical outcome. In my 25 years, I have never seen anybody coming out having anal fissure again, because it is an anatomical problem. It is because of the sphincter. If I operate on that sphincter, so it doesn't comes back. He have a lot of pain before operation, but after operation दर्द इतना कम हो जाता है कि ऑपरेशन का दर्द उस दर्द के बराबर कुछ भी नहीं है, and they are very happy. Fissure, this is an excellent disease. Next slide, please. Yeah, Dr. Nayak, my younger brother, my friend, my mentor, we had been working together for last 20 years. We are educated together. We are family member like, and we work in tandem, and I'm blessed to have him beside me. He is a big support for me. And I would say even he does laser better than me. So next, please. This is our laser proctology department from Medica Superspecialty Hospital. I'm very thankful to my hospital and particularly my chairman, sir, because when I came to the hospital, I pleaded with the sir, please give me laser, please give me laser, please give me laser. And in a moment, he gave me laser, and I'm so happy because right now we have our own laser, and it is the most ultra modern laser sir has given me. I can operate early morning 8 o'clock. I operate at the late night 8 o'clock also. I've got wide range. So I'm very happy. I'm thankful to sir very much for giving this liberty to work. Anytime I can do laser. Thank you, sir.
Thank you. I mean, you all will agree that the 6 times he has repeated beauty, and once he said magnificent, and a couple of times he said that it's very nice. I mean, only a doctor who's really committed to his profession will find beauty in anal region, and he is so happy to kind of support you with the treatment which is available. Now, doc, I would like to know that what causes hemorrhoids?
Hemorrhoids,
and fistula and fissure. If you can give us the reason why people get hemorrhoids, why they get fistula, why they get fissure.
Surely, sir. Hemorrhoids. The most important cause for the hemorrhoids is constipation. Because continuous, if you have constipation because of your very bad food habit, because of junk food or anything, or habitual constipation, if you constipate, and if your bowel movements are not good, and if you are continuous, you're sitting in a toilet and you are sitting for 30 minutes, you are pressing. And I will just like to give an example to everybody. It's a very small example I give to my patient in OPD. If you just see an animal on the road, when he starts to pass stool, that cow will just put up his tail up, first he will pass stool, and the valve is closed. So that is the mechanism for every living creature. We pass our stool very quickly and our valve gets closed. But in a toilet, in a bathroom, if we sit for 30 minutes, we read newspaper, we sit, we press. What happens? There will be venous congestion. Piles is because of the venous congestion around. We have got the venous return cannot happen. So small thing happens like a grapes. This gradually, as the child grows from the small one to bigger one, this piles also from grade 1 to grade 2, from grade 2 to grade 3, from grade 3 to grade 4, like that. So that is the main cause. Another cause is post-pregnancy. When a female, previously when we didn't have LUCS, I mean there was no cesarean section, when they have to for a baby delivery, that happens. And there are other diseases also like Crohn's disease or other medical disease. But mostly 80 to 90% of piles occurs mainly because of bad food habits and your chronic constipation. This is the meaning. So paikhana mulayam hona chahiye, soft hona chahiye. You should go to toilet, you had an urge, pass your stool in 5 minutes and come out. Don't sit there and wonder, don't do research sitting in the toilet, and don't press upon. That is the main thing that happens. Piles happen because of that. Now I'll come to next disease, that is fissure. Yes. Why fissure happens? We have got an external valve, our anal verge. So like this, it has got an elasticity mechanism, like this valve mechanism. This is the exit part. So suppose you are in a shopping mall, like you feel like passing stool. Do you pass stool? No, you can hold it, you keep it. Then you find a suitable place, you go there, then you gradually, this valve opens, you pass your stool, then this valve closes. But with chronic hard stool or constipation, because our external anal verge can only allow one finger, but beyond it, the rectum and the anal canal, they are quite wide. The circumference is around 4 to 5 centimeters. So stool comes in a very with a big diameter, and it tries to pass us through a small diameter. Then what happens? If this valve is not in a relax, it has lost its elasticity. So what happens? If a thick stool tries to pass through a narrow thing, it will tear up. It will tear. This thing tears. So this gives a throbbing pain. This tear gives a throbbing pain. Then what? You will have a bleeding, but that is 1 or 2 drops. This bleeding is along with the stool. When you pass the stool is passing, and through this cut, blood is attached with the stool margin. and you will have a burning sensation. Why? It is cut. This is called fissure, and your ulcer is formed. It's a very, very painful disease. Like you cannot sit, you cannot pass, you cannot eat. So it's very distressing. This is called fissure. Now another disease, fistula. Fistula happens at fissure happens mainly because, again, that same thing. If you have if your bowel movements are not good, again constipating, hard stool, mainly hard stool. Like in our medical science, we tell scabella, if you pass out and if you try to pass a thick hard stool and it tears, that because of that fissure happens. Now I'll come to the last disease, that is called fistula. Fistula is, I have explained, suppose this is your national highway, another is service road. So why it happens? 70 to 80% in our perianal region, we have got many perianal glands. You can feel in our hand, it is very dry. But in our perianal region, we have got multiple glands and it makes moist. That area is always moist. Gila gila rehta hai. So what happens? These glands sometimes get infected and that area is highly contaminated with microorganisms because you are passing a stool. These microorganisms are around the perianal region, but once there is a breach in the perianal region in the gland, those microbes, they enter, then they form an abscess, like abscess in both sides of your anal verge, this side or that side, maybe both sides. That is called ischiorectal abscess. In Bengali we tell phoda hoyeche. So when that phoda happens, abscess, he will come to you, we operate, or they are mainly they get operated from local people, or they take medicine, or automatically it bursts. So fistula, when this abscess is drained or this abscess occurs, they destroy that area, and that from that it gets connected into the rectum, a pathway is formed. So 80 to 90% of fistula occurs because of the previous ischiorectal fistula or ischiorectal abscess, sorry. So whenever a patient comes, he tells me, sir, मेरा वो हर दिन वो रस निकलता है. कितने दिन हो गया? 6 महीना. 6 महीना का पहले में आपको कभी पायखाना रास्ता में कभी फोड़ा हुआ है, कुछ घाव हुआ है ना? हाँ सर, उसके 2 महीना पहले हुआ था. So these are that is the main reason. And fistula happens in some other diseases like Crohn's disease, tuberculosis, and we have got some many other medical diseases, sarcoidosis, like that. There is a tendency, there is a propensity we can have a fistula in the perianal region, but those cases are very less and rare. Sound?
Sir is muted.
Sir, I can't hear. Sir,
sorry, you explained it very well, Dr. Chand, and you are good at explaining. It was very, I'm very impressed the way you explained such a difficult and such a embarrassing thing so nicely and easily. Dr. Chand, tell me that constipation happens mostly in women, if I'm right. Is the piles more common for the women or the men?
I don't have that statistic, but yes, piles are more common in marginally more in women than in men. Marginally more.
And the treatment stays same for both of them.
Yes, sir. Yes, sir.
Right. Now, Doc, before we proceed further, you have said the advantage of laser. What are the disadvantage of laser?
Yes. Like I'll say in a very simple thing. जो चीज बहुत अच्छा है, the thing which is very good, उसका खराब भी बहुत खराब है. Like flight, accident means khatam, but in 2 hours you can reach Delhi. But that happens very rarely, sometimes. So laser has only one complication. If you cannot target it like Balakot strike, you have to set your target. You have to fix everything. Everything is there. Before I do a laser, everything is ready. Somebody gives me command. He gives me command 120, 130, 140 like that, and I'm firing. Because I finish the procedure in less than 60 seconds, sir. So it is a very precise surgery. I should know. I should have a apt knowledge of anatomy of that area. If I do a little bit mistake, then that area will blanch, will become black, then abscess. And sir, and till God, by God's grace, till now, I haven't got that complication, sir, touch wood, because before I do the surgery, I pray to God that it should not happen to any patient. So I am very particular before I do surgery. And the main thing, ice packs. Ice is very important because they are very high joule energy. So whenever I operate the previous night, I definitely call my sister in charge. The ice mera hai ki nahi. I see the ice, then only I take the patient to my theater. Because after firing the laser, instantly I have to put the ice cube, I have got a very innovative method to put the ice inside that rectum. What I do right now, sir, I take a gloves number 8, I fill it with water, I pack it, and I just put it like it in our OT refrigerator. So like fingers. So they come like that, I break it and I just put it inside and I press it. I keep it for 5 minutes. That is the key for the laser surgery, sir. Precision, ice, timing. Timing is very, very important.
So as you said that what I have understood is that hemorrhoids or piles are a kind of protrusion where they come out of the anal canal, and there are different grades, 4 grades, grade 1, grade 2, grade 3, and grade 4.
Sir.
Whereas fissure and piles are painless.
Yes,
and
sir.
the bleeding is a painless bleeding and sufficient bleeding. You said
Sir.
in fissure, the bleeding is along the stool.
Sir.
And it's a very, very painful.
Yes.
Now, and you said it's the most painful disease. And you said that pain of surgery is much lower than the pain of going through. In fact, if I remember our surgical classes, one of the condition of differentiation was that man used to sit in the bathroom with a whiskey bottle. We are old timers, in our time, that description was very, very apt, that we knew that he has a fissure, not piles. Piles would have been painless. And of course, fistula is an ongoing process, goes on and on. A lot of discharges here and there around the anal canal. Now, instead of in fissure, which is very painful, instead of laser, can we do by the dilatation technique? What is dilatation technique, and how does it work with the as compared to laser?
No, sir, you're right, sir. Previously, what happens, particularly in fissure, there is a sphincter. The operation is done lateral sphincterotomy. So before a surgeon does a lateral sphincterotomy, what I do?
Can you just explain? Say, in sphincterotomy, I understood, but the many common men may not understand.
I am telling. There is a valve. Ye ek valve hai. This is a valve which is like a elastic. It has got elasticity. So normally it stays like this. When you go to toilet, your brain gives information to this valve, bhai abhi kholo, abhi humko potty karna hai. And this valve gradually opens. You can feel it in the toilet, and it opens. You pass your stool. After that, this valve closes like this. So destruction of this valve, the loss of elasticity of this valve, what happens? It tightens up. So when your thick stool try to pass through this narrow pathway, this valve is stretched. This valve is stretched and this valve is torn. It is torn here. And that is called fissure, tearing of this place. And it will have, this tearing gives a lot of pain, and the valve, tearing of the valve will give you spasm, dhak, 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 dhak pain. Like खोड़ा होने से बहुत दर्द करता है, धक 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 करके pain होता है. So that is fissure, and this destruction of valve is called fissure. And what we do, since it can only allow one finger, so since I have to operate inside through laser, usually in the anesthesia room, after the patient is given anesthesia to that area, slowly I put one finger, then 2 finger, then I put 3 finger, I dilate that place. Because our anal canal can easily take 3 finger. This is the theory. So I dilate it, it gets dilated. Then only I am able to put my other instruments inside, then I can operate. And this dilatation also, it is also a procedure I mean, it attenuates the entire procedure. It is an add-on to my laser, or it is an add-on to my surgical procedure, because suppose if I don't do anal dilatation and I do a laser, still this external sphincter, this sphincter is still tight enough. The very next day he will pain. So if I dilate it, yes, the anatomical correction is done, the defect is corrected, but at the same time, I have dilated that pathway. So whenever he passes the stool the very next morning, he can pass it very nicely. So anal dilatation is also a procedure, sir, for the fissure. But yes, my laser and my traditional operation, they are an additive to my anal dilatation, sir.
So it helps, it's kind of adjutant.
Yes, sir.
Very good.
Adjuvant.
Now, once you have talked about when the tight anal fissure, is there a certain pregnancy or certain disease where the anal sphincter becomes loose? Then is something of Kegel exercises to strengthen anal muscles?
Yes.
What are those? Can you just throw some light on that?
Sir, like old age, it mainly happens in the old age because laxity of that place and big multiple pregnancy. Previously, what happens, our grandmothers and all, they had 10 children. So continuous pressing down, that entire perianal region and that area, that completely is laxed because continuous bearing child in the abdomen, that brings a laxity to that area. And yes, there are certain diseases from inside also which laxes that area. So that is what happens. And
what is Kegel exercise?
Kegel exercise is, sir, you stand up. Like if you say I can stand and show how it is done. So like
if you can show it, please go ahead.
Like tightening your thigh. So just a minute. Just I'm standing here. Okay, sir. Like I'm standing here. Just tight. You get tight. Full.
Okay.
Your thigh muscles, your gluteal muscle, you tighten up and fix it towards yourself. That is called Kegel's exercise, and that I advocate to my patient for those who are having this lax here. And in our hospital, we are doing laparoscopic surgery. We are doing laparoscopic rectopexy. So we go from inside and we pull up the rectum and we fix it from inside and you do it, and result is very good. It's a very nice surgery, but it's very advanced laparoscopic surgery.
Fantastic. Doc, you said in the beginning that when we find a fissure and a bleeding, then I do colonoscopy, advise colonoscopy for polyps. So when should one colonoscopy where you put a tube inside and check the colon? So at what age onwards you should check the colon regularly in India?
Sir, screening colonoscopy, actually screening colonoscopy is not advocated routinely for Indian population because our large bowel diseases are mainly prevalent in western part of the country. And if at all the screening is done, it is done continuously for few diseases like familial polyp, somebody is having Crohn's disease, ulcerative colitis, and mainly familial polypial diseases are there, where the screening, where it is done from the very young age, like the age of 21, it is being done annually. In somewhere it is done every 6 months. But ideally, it should be done beyond 40. It is done as an annual checkup if he is having any problem. And here, when a patient comes to OPD, sir, if he has a bleeding, and if it is a painless bleeding, splash on the pan or fresh bleeding, so they come and tell, sir, I am having piles, you operate it. You do laser, please operate it. Tomorrow I will go home day after tomorrow. I tell them, yes, I will operate. But how come you know it is coming from your piles? Because in my OPD, with my proctoscope, maximum I can see 4 to 5 centimeter. I examine here, I do with my finger, then I examine with my proctoscope. But that area is very less because the entire 150 centimeter, the large bowel, till the cecum, large bowel. Then I send the patient to gastroenterologist in our hospital to do a colonoscopy. I tell before I operate, yes, I operated your piles, The very next day again you have a bleeding. Then what I will do? Then what you will do? So before I operate on it, I should be 100% sure it is coming from your piles. Yes, beyond piles, a polyp is sitting. A bleeding is coming from there. I went and I operated on piles. After 7 days, again it is bleeding, splash, same thing. Then what I should do? That patient will hit me like anything. So before I operate, sir, whether any piles, whether any tumor is sitting somewhere inside the colon, and when the stool is passing, it is pressing and it is bleeding. Fresh bleeding means it is in the large bowel, and black color stool means it is melena. That is means upper GI bleed, maybe from stomach, maybe from duodenum. For that, we need to do endoscopy to rule out if any upper GI bleed. And in our hospital, we have got capsule endoscopy. ऊपर से नीचे तक हम सब देख सकते हैं. Finished.
So you say that before you touch any piles for laser, you have to do for fresh bleed, you must do a colonoscopy.
Yes,
and
yes,
if it's
sir.
a melena or black blood, you have to endoscopy and find out what's happening. Without that, you cannot take a decision what needs to be done.
No.
So that's very clear. And I understood your Balakot surgical strike, that you have to be very precise. There's a lot of planning, precision, and then the result is always good. Doc, one thing I'd like to know, that how to prevent it. What are the food which one must change to, or what food they should really subscribe to for them not to have constipation and not to have a piles or fissure or a fistula? Yeah.
So
What is the role of food?
Yes, that role of food is very, very important, because lifestyle modification is very important. Okay, sir, what happens? Like, we all are human beings. We eat. At certain point of time, when we feel or when we have any symptoms, then after that only we have to change. After that. So, plenty of fruits, vegetables, like what not to eat, like all those junk food, maida items, and these noodles and all pasty items, like which the motion of the stool will be not, roughage should be there. You should have plenty of roughage, like salad. You should have plenty of salads. You should have vegetables, and you should take chapati, and 3 to 4 liters of water every day. That is very important. Yes, you can have your food, but not every day. Like today's in a click of a finger, Swiggy, you are sitting at home, aaj mood nahi hai, Swiggy maar do, khana aa gaya. Ek din acha laga. Next day you forget, yesterday you have taken, again you order today. So it becomes a vicious cycle, sir. Now in present generation, in my OPDs, currently I am seeing very young people, IT guys, when they like 22, 23 years, fresh naukri mila, they come running to OPD. Sir, laser yahan pe hota hai, kal kar dijiye. मैं परसों से ऑफिस चला जाऊंगा. चलो, व्हाट इज द प्रॉब्लम? ना ये खाना क्या खाते सर? वही दिन भर तो वही चलते रहता है बैठ के. So food habit, lifestyle modification is very important, but yes, it doesn't start from the very young age. Like, I cannot admonish my daughter to take roughage and everything at the age of 10 or 15. Yes, if she has a symptom, from then onwards, you have to take care of your bowel, because what you put inside here, this is very tasty. But what exists, that is very painful. So that is what we all have to take care of. Sir, you have muted me.
Doc, is laser harmful for pregnant women?
No, not at all, sir.
So in pregnant women also, the laser treatment can be given in piles and fistula.
Yes, sir.
And the fissure. Doc,
yes,
something very interesting you said, that people sit in the bathroom and they keep on reading and doing. Nowadays they do WhatsApp. So that's not a good practice,
no.
I guess.
No, sir.
Because you are not putting enough pressure for evacuation. Is that so?
You should not sit for a long time.
Okay.
Like I gave a small example, sir. I always give small example to my patient. If you observe any animal, you see how they pass stool. They are very quick. Yes, sir.
Yeah. Yeah.
The same mechanism is also for human beings, for everybody who passes stool. That it doesn't take time. It takes only 5 minutes time. You can see when you are having a real good urge, or when your roughage is very, when your bowels are very clear, you go You finish it off, and within 5 minutes you are off, sir. And you feel full, fresh, I have emptied. So that feeling you should have. It not, but if you constipate, if you sit there, and if you continuously put pressure on your anal canal, continuously, you are reading newspaper, you are doing WhatsApp, you are taking tea, you are texting, you are doing all sort of things sitting in the toilet. Because you think nobody is there to disturb you, but you are disturbing your anal verge to the extreme point.
Doc, last question I have. You have really explained beautifully. And I'm also started using word beautifully. Doc, tell me that a lot of people cannot pass stool unless they smoke. How true and how
This is psychological. This is psychological, sir.
Really?
This is psychological.
But
Yes,
they
sir.
vouch for it.
Because
They say,
for
"If I
them,
don't have a cigarette-"
No, that is psychological, sir. Because see, I will explain this. That opening of that valve, the command comes from the brain. That commands not come from here. Okay, sir. So it has only one command. Brain will, through parasympathetic, brain will come. It has got a command through that pathway. How that urge comes. If you have a good motion, if your rectum beyond this anal verge, if the stool comes and it is loaded here, and you are pushing on your anal verge, ki mere ko nikalna hai, mere ko nikalna hai. Sometimes you must have observed, you just have a few more seconds. If you wait, you can pass your stool, not in the toilet, on your bedroom itself. So it pushes and pushes. Okay. So this is the thing gives the sensation, not this, sir. So this is psychological, because you go to toilet, you feel ki toilet is my home ground. I can do anything here. Nobody is there to disturb me. Daughter, children, wife, nobody is there. I can smoke. I can do WhatsApp, and on the name of passing stool.
And the
I
stool
think-
doesn't get passed, and you have a problem.
Definitely, sir.
Yeah. So, Doc, truly last question. Tell me, what is the role of roughage, the isabgol and that soft stool, soft wax? What is the role of them?
Yes, they have definitely got role. Who are symptomatic, we have got grading, sir. We select according to age, according to means there are other comorbidities or anything else. We select, and we have got grading, like from this A grade, B grade, C grade, D grade, like that we give according to the patient. And they are basically, if the take for a long time, it becomes habitual. Out of this, I personally feel isabgol is very good because it is non-habitual, and it is very good for old age people, because old age people, that same intestine has been working for 80 years. So it has lost its tonicity, and they love that isabgol to eat, because in their life they have tasted, and these all laxative, the taste is very horrible, sir. Just because you are afraid of the pain very next morning, you are forced to drink it. Otherwise, nobody likes to drink laxative, sir.
But they can have roughage, they can have palak ka saag, they can have saag and vegetables which act as a laxative. They don't get absorbed in the system. There's tons of roughage in it.
Chapati is a very nice roughage. If you take chapati at night, that is a very good roughage. And out of all the fruits, I recommend personally to the patient guava. Guava is a fruit which is available in Calcutta, so it is available 360 days. And it has got other nutritional and very good values. And at the same time, it's a fantastic roughage, sir. And what I'll say, even I take guava, and it helps me a lot, sir. Everywhere.
Thank you very much, Dr. Chand. Fantastic. We had
Thank
a
you,
great session with you. And the way you explained that there are 3 kinds of problem at the anal end, at the exit end of our body of alimentary canal, the hemorrhoids, otherwise known as piles, fissure, and fistula. You said piles and hemorrhoids are painless and they bleed painlessly. You said that fissure is very painful, one of the most painful conditions. And you said fistula is a recurrent, keeps on happening now and then. So, and all 3 can be treated with a laser. And you explained very nicely that laser makes a stay of just 1 day, even less than a day sometime, and you get discharged, and you can go back, and there's no recurrence. So that also makes it much healthier. And you warned us that eat good food, eat food with roughage,
And if you have a roughage in your food, you will not need a doctor like you. And you are happy for them not to come to you because it doesn't help them if they suffer. And that's what we intend to do. We intend to keep you suffering free. That's why we bring every week, 5:30 to 6:30, this webinar, Health is the Ultimate Wealth. We're extremely thankful to you for joining us. We have our two partners, Bengal Chamber of Commerce and Industries, which sends it to their members. Please share with your more friends and relatives. And we are extremely thankful to Rotary Club of Calcutta, Vienna, who has joined us in taking the message to your family and friends. We want you to stay healthy. Health is the ultimate wealth. Medica is committed to you and to your health. Please join us again next week, Saturday, 5:30 to 6:30. We will have next week a talk about liver disease. What are the commonest liver disease? Everybody has a fatty liver these days. What leads to fatty liver? What happens? How to look into it? How to prevent it? How to live a healthier life with a healthy liver? Liver is one of the largest organs this body has. So we'll take you there, and you will all agree with me that Dr. Chand did a fabulous job. Chand, you are a hero. You did a great job of such a drab subject. You made it so interesting. You was beautiful, fantastic, nice surgery. I'm very interested too. Thank you very much. Have a nice day. All of you have a nice weekend. Thank you.